It's 2:01, and what's going on? What's going on?
And if
You're wondering what's going on.
We're trying to start the music, folks.
We're trying.
And I think we're back. Yes. Hi, everybody. Hugo Fernandez. I'm the host of a new incarnation of my radio show. I'm calling it What's Going On. I don't know if you guys have followed me over the years. I started a show a long time ago that was called Difficult Dialogue. It's kind of a grant we were working with the Ford Foundation. That turned into How It Works, which is about the college. Recently, we changed it up to what I was calling It's On, which is actually a combination of what's going on.
Yeah, we changed
Get it on.
it up to.
I remember a couple of Marvin Gaye songs. I'm doing it. I'm putting it up.
For the title mark, though, I use the question mark, whether you find it that way or not when you do your own searches for it. And I wanted to, interestingly, we start the show today talking with some folks who are working with students who find themselves on the front line of what's going on in the country, the pandemic against COVID-19. And I wanted to thank them for attending. And I didn't get a chance because we were having a lot of technical issues. I don't know if you noticed at the beginning of the show. Paula DaSilva-Michelin, or do I say Michelin? Michelin, from the Center for Immigrant Education and Training, and Tania Ramirez, who is the program manager for NYC Welcome Back Center, who both find themselves working with students who are immigrants who come to us with skills from the countries they've come from, particularly in nursing, in the case we'll be talking about today. And these folks work with them to prepare them to pass the tests which make them eligible to then practice their professions here in the United States, and are now, I think the number is 9 recent graduates who are finding themselves working with patients who are struggling with this terrible virus that we find ourselves combating. So, want to say hello, ladies? Paula, you want to say hi?
Hi, everyone. Thank you for inviting me to be part of the show, Tania and I, and have the opportunity to share the work that we do at CIET, the Center for Immigrant Education and Training. We are very honored for the time to share what we do. Thank you. And I want to say hi to my staff who's watching.
Oh, very good.
Oh, very good.
Tania?
Tania?
Hi, everyone. Good afternoon. My name is Tania Ramirez, Program Manager with the New York City Welcome Back Center, part of the Welcome Back Initiative, which we might get into later, and part of Adult and Continuing Education at LaGuardia Community College. Like Paula said, we're really happy to have this opportunity to showcase the work of our immigrant nurses, and we all feel very proud to be part of this endeavor, which is helping families and the city during this time.
Tania, you look like
you're ready for Good Morning America. You're dressed up. I'm here in my grubby stuff. Even my top hat does not look particularly good. But anyhow, I wanted to
Things in sweats for like a week.
She's been waiting for this moment. You just don't understand.
I'm more than happy to hang around, in
PJs
and things all day.
But I wanted to
though I've changed the name of the show and the focus is obviously on what's happening right now, I haven't changed what I typically do because I like to give people the opportunity to
talk about
talk about themselves. Some folks who will watch the show don't know anything about your backgrounds and who you are. So I want to give you each a turn to talk a little bit about yourselves, like your own backgrounds, possibly where you went to school, and your studies, and how you found yourself working here at LaGuardia Community College, and the roles that you are in today. Who'd like to go first?
Paula?
Paula?
Tania, do you mind going first? I think I have a delivery at my door. Sorry.
It's all happening. What's going on? Food. That's what's going on. Go ahead, Tanya. Why don't you go first?
Of course. Okay, so I've been working at LaGuardia Community College since 2005. Started out at the Center for Immigrant Education and Training as a social worker and counselor. I did support groups for the immigrant community, specifically the immigrant women, to help them with adjusting to family life and work and managing responsibilities. So I worked in the Center for Immigrant Education in different programs, and then around 2010, there was this endeavor to connect with the Welcome Back Initiative, which is a national organization that started out of California. A gentleman by the name of Fernandez, who's a doctor in Mexico, started this organization. Sorry, I was getting a text. And his mission was to create an organization that would support immigrants like himself who wanted to work in healthcare but were encountering many challenges, such as ignorance to the licensing procedures, misinformation, lack of financial resources to take exams, of course, addressing the needs of language learning as well, which is vital to what we do at CIET. And since that idea blossomed, there's been a growth of like about 12 welcome back centers across the United States. And in 2011, we opened up the Welcome Back Center here at LaGuardia Community College. And since that time, have been working the grant-funded program called the NCLEX RN ELL program for English language learners, the NIBEST model, using the NIBEST model, of course. And that program was to support immigrant nurses to pass the NCLEX exam. So yeah, we've been doing the 11. We have over 300 nurses that have completed the program since that time, and over 250 who are working currently in New York City as nurses or licensed practical nurses.
You mentioned the NIBEST model. What is the NIBEST model?
Yeah, thank you. NIBEST model is a model that is developed that incorporates at its foundation team teaching. So essentially, it's team teaching between, as all of our nurses are from different countries. We have the majority of nurses from Haiti, from Central South America, Russia, all non-English language speaking countries. And their need in order to pass this NCLEX exam is to improve their language skills. So the NIBEST model incorporates professional instruction with professional instruction. Again, I'm sorry, my father's texting me.
It's okay. He knows you're on the radio.
And
I hope he's okay.
Yeah. So it basically incorporates instruction from technical teachers, which are the nursing instructors, and English language professionals. So it's a collaborative model that, and Paula can speak more to this, that enables students to grasp the nursing content with the support of an English language professional in the room. So that's essentially what NIBEST is.
Okay.
Okay.
Paula,
you got your food.
Did you,
It wasn't food. It was a delivered. Um,
Okay.
you want to talk a little bit,
You want to talk a little bit again about yourself,
your background,
your background, maybe
maybe
what you studied,
and how you
found yourself at LaGuardia Community College?
Sure. So I'm originally from Brazil. I moved to New York in the 1990s. In Brazil, I was an English teacher as well. So once I graduated from college in Brazil, I moved to New York, and I started working with the immigrant community, specifically at LaGuardia in 2003. And I've been there. First, initially I was a ESL instructor, and then I became a coordinator, and now I'm the director for the program. So this is my territory in the LaGuardia Community College, CIET, and CIET, we work with low-income immigrants, like Tania was saying. We get students mainly from Corona, Elmhurst, Jackson Heights. They come with different needs to our program. We work with students who do not have a high school diploma, who are, have parents who need help with their kids and their homework. The language is a barrier for them to be able to succeed and move ahead. So our work is to provide the community with the resources and the services they need so they can become really successful, or as successful as they can here in New York City. And most recently, we've been very successful with the NCLAS, as always, program, because the nurses really, they join the program. They work with low, their salaries are very low, their home health aides, and by taking the program, and a year later, they're able to find jobs, and it's really a life-changing experience for them and for us to see a great impact in the community. And Tony and I are here talking about the program, but this is credit for everyone that works with us, because they really invested in helping students to be successful learners, especially in a time like that. Our case managers spend hours with the students on the phone, like I'm sure across New York City, every counselor is doing the same thing, trying to offer them services and make sure they are okay. So I'm very proud to be part of the team. Yeah, that's it. That's me.
You mentioned the NCLAS program. Do you want to elaborate on that a second?
It's the national, it's a program that Tania managed. So the goal of the program is to prepare a student to take the National Counseling Licensure Program. Yes.
Licensure examination.
Yeah.
Yeah.
So you know what? Oh, sorry. Did you want to say? You go ahead, Paul.
No, I just wanted to add to that. So essentially, it's to help them pass the licensing exam and work in the city. Can you hear me?
I can. I'm going back and forth since we didn't have a lot of prep time, and I keep flipping the names. That's me. It's again this issue of the.
No, I know. It's okay.
Go ahead. What you were saying before?
Yeah, I know. This is the first show too, so.
In this model, yeah, this format, yeah.
So essentially, it's not only to help them pass the exam, of course, but it's to help them get work in the United States and in New York City specifically.
Yeah, remind me to say something about that a little bit later. So I don't, I'm trying to understand, because I heard about this program before, and I guess I'm having, I don't want to say it's a senior moment, but basically the rest of my entire life is like a senior moment at this point, where I don't remember. My wife could tell you, go on about all the things I don't remember that I should have. But I've talked about this program before on my show, and I was looking through my archive because we keep an archive of all our shows on SoundCloud, and there's 35 from the previous incarnation it's on. And the only one I can put my finger on is when Janet Pinto retired. She came on and did an exit interview. Did that name mean anything to you?
Yes, and right after we came, because I think she mentioned it.
Yeah, exactly. Okay, so she talked about that show. What do you mean after you came? She showed up after you showed. She was actually went through the program and eventually started working there. I mean, she went through the ESL programs in LaGuardia, right?
That's correct.
So she
I don't
was.
know if she went to our program necessarily, but
No, I just mean like ESL. I think she was in CLIP.
yeah.
And she was in CLIP, and she ended up, becoming the accountant for a lot of the programs over there. Which for those who don't know, we're obviously talking about the Division of Adult and Continuing Education, which makes is a third of what happens at LaGuardia. And people don't understand that. There's the academic affairs, and we obviously have a big piece. But ACE is a huge program, and I think I don't get the numbers. I don't know if you know the numbers. ACE has as many, if not more, students than the regular LaGuardia full and part-time students. Right? Isn't that correct?
That's correct.
I am correct about that. So let's talk about. So we're going to be speaking specifically about CIET, right? The Center for Immigrant Education Training, or the Welcome Back Center together. Now, these are the programs working together in this process of training nurses, or how does that work? How do the two distinct programs work together? Or am I wrong? It's one inside the other. I'm trying to visualize it.
So New York City Welcome Back Center is part of CIET, LaGuardia. I mean, and Tania can speak more about it. The Welcome Back Center is a national initiative, so there are different centers in different parts of the country. But specifically in New York City, the New York City Welcome Back Center is housed at CIET, and we work together. You're like a team.
Okay, so it's two programs working together. Mm-hmm. So why don't we let's break it down then. So first of all, how do these folks find you? I was gonna say these ladies. I don't know why I want to assume that it's majority, but I'm wondering if you ever get any male nurse practitioners who you do that come from other countries. So how do these folks find you? How do you find people to do this? Is it all word of mouth? How does it happen? How does somebody come to your program?
Predominantly word of mouth. As I said before, we've been doing this since 2011, and the first cohort of nurses, I want to say it was like 15 nurses from the Haitian community, Polish, Russia, I think were some of the nationalities in the class. And we did some outreach to community organizations, worked with the Queens Immigration Task Force, announcements with local CBOs, the libraries, our partners at the Queens Public Library, as well as our partners at Upwardly Global and other organizations that serve the immigrant community, World Education Services, etc. And then the word got out, and little by little, we had nurses. When we did our opening for the Welcome Back Center in 2011, there was also some media that was out, different local newspapers. I think the Spanish newspapers, El Diario. We have some press in Univision, New York One. So word got out, and we had a substantial wait list after that time. And I think since that time and the growth of the classes year after year, we have relied heavily on word of mouth, referrals from other alumni in the program.
So you don't have to do recruitment anymore at this point. It's kind of like the other LaGuardia nursing program, the one in the academic affairs program, where it's like people are killing each other to get into them. So there's those students drive me crazy because they always come to me and they say, I've got to get an A because without the A, I can't get into that program. But so you're waitlisted at this point, and it's And is there any particular? I mean, I guess it's funding that limits the scope, the size, right? The size of the programming, or the fact that you can't bring in as many people as would like to participate. How long is the wait list?
At this point, we have over 300 on the wait list.
Oh my God.
We do need to do more recruitment. I think moving forward, that's something, especially, if this pandemic changes the need for nurses and we need to grow the program we're going to have to definitely do some more recruitment. But yeah, I think we do have a healthy list. And at this point, if this pandemic wasn't going around, we'd be recruiting for our next sessions. Yeah. We had a class that finished in February, and those nurses are really, the ones that are, most predominantly impacted by this, because we have about 26 nurses out of 3 cohorts who have permission to take the NCLEX. But because of the coronavirus and Pearson VUE centers closing as a result, those are the testing centers for them to take the NCLEX. They can't take the test. So they're ready to test, they're ready, to move forward with that. But the Pearson VUE centers have closed. And if they are open, they're only allowing 3 or 4 people to test at the same time. So yeah, it really has slowed down their ability to to move forward. And then we also have a handful who are waiting for permission at the New York State Education Department for approval to take the test. So that's kind of like some of the gridlock that we're experiencing now, because of things being closed and some of the barriers that our immediate nurses are facing. They're ready to work.
Right. But it's about licensing and the social distancing problems that cause. I know it's a big deal for the testing, that be like kind of a proctored experience, right? That somebody's there while they're taking the test, that kind of thing.
Yeah.
It can't be done. Paula,
I just want to add something to what Tania was saying, and I want to also give you one other factor that some of our nurses have not been able to test. Some of them have tested, and then financially to pay for the test is an issue for them. But we're able to get the LaGuardia Foundation. I want to give a shout out to Janet Corcoran, Joanne Halligan, and Diane Fernandez, and Liz Yanati, who coordinated the whole request. So now the foundation had paid for these nurses to test. They've given them scholarships, so that's going to be very helpful to move them along and have them become licensed and be able to work and join the workforce now in New York City. They do have a long wait to test because, like Tania mentioned, the testing centers are really not operating full capacity.
So yeah, that's a good point to make, because I think this also happens in the education program. Sometimes certain tests that they have to take, sometimes it's not even a lot of money, but it's just enough to make it difficult for the person, or whether it's buying certain kinds of supplies. And so it's great when the foundation can step in and do that. It's 2:30, and I just want to do a quick. I realized now that when I started the show, I didn't say this is LaGuardia Web Radio, WLGR, even though it's a different platform. I mean, we're talking on Skype, and we are transmitting through Twitch, which a lot of people are watching through YouTube. But it is still LaGuardia Web Radio, louder than you think. I think that's still our call piece. I'm Hugo Fernandez, the host of What's Going On, and this is an inaugural show of this iteration of the radio shows I've done in the past. And my guests here today are Paula DaSilva-Michelin from the Center for Immigrant Education and Training, and Tania Ramirez, the program manager for New York City Welcome Back Center, both here in adult continuing education at LaGuardia. And so I want to start talking a little bit because we've already eaten up a half hour with just some of the background info. I wish we could talk some more about the program itself. But I want to talk to you about, you came onto my radar by virtue of interim President Paula Carrio's shout out email, which I love that Paul does this now. Cario does this where he, tips his hat to people who he feels are doing important work, good work, and obviously the response from folks has been big because people were responding. But I thought, I wanted to get something that was timely on the show, and so you were saying before, I think the number is 9 graduates who I guess got their licenses in February are now finding themselves working in the New York City health industry and find themselves on the front line of the virus, COVID-19 pandemic. And what do you know about their experience so far and or how they were placed and what they're doing? Ladies, either one, Tania or Paula?
Tania was the lead on that one.
Tania, you want to lead on that one?
I can speak to that. So yeah, we have 9 graduates. Our program ended February 27th, and a few of them were able to test before this whole thing, burst on the scene. So they were the first ones to pass. And then a couple of others after them, they were scheduled to test, but because of the social distancing and closing of the licensure centers, they had their tests postponed. And as I said earlier, we have more than a handful. We have about 26 who have postponed tests and are waiting to test. So, they have their license now from New York State, and not all of them, but most of them are working in the field. It's been a slower entry than normal into the workforce because of this. Many of the nurses have cited concerns about, having elderly at home, children at home, and not wanting to go out and become infected. I know in speaking, I've lost you there. I know in speaking to our alumni, because what we did, one of the first things we did was send an announcement out, an email blast to all of our alumni. And as I said earlier, we have over 250 who are working in the field, to see what their experience is like, and how if they're feeling supported, if there's anything that we could do, and just to touch base with them. And many responded and reported that they're working and doing the best with the conditions being what they are. Actually had invited an alumni to speak today, and she reported that she's diagnosed with coronavirus, COVID-19. So she is one of the ones who has been very affected by this. Yeah, one of the statistics. But overall, I think the nurses are saying that it's busy. If they're understaffed, the fact that nurses are calling out now, getting infected, being sick, minimizes already depleted workforce. The nursing profession here in New York City, needed more nurses before this happened. So yeah, the fact that we as an organization focus on bringing immigrants who have healthcare credentials from their countries, who have the skills, the language skills, the cultural competency, everything that they need in order to work and hit the ground running, because many of them have years of work experience in their countries of origin, is very important right now, because it's an untapped workforce. Preparing for this phone call, I was doing some research. There's a lot of articles now that are talking about this because, New Jersey governor, for example, did an executive order that allows international medical graduates to work if their license is in good standing outside in their home country, to work in this crisis here in New Jersey. And New York State Education Department has made some allowances, to lessen the amount of time needed to do residencies and things like that. But I mean, a lot of these bureaucratic barriers, I think, are really imposing on helping our population, our nurses in particular, work and get back to work in their field. So,
yeah, it'd be interesting if the governor, with all the things he's trying to do to solve this problem, if he were made aware of the fact that testing is getting in the way of getting more bodies into working in the front lines to help people. Is something, Paula, did you want to add to also?
Tanya's
yeah.
I would just want to add that the nurses that we work with, they have a second language or sometimes a third language, and in this kind of crisis that we're facing right now, I think they have a valuable mission when they're going to a hospital, because it's not only the linguistic barriers that a lot of times they can help their patients with, especially in Queens, but also is the cultural setting where a lot of times the values of their home country, it's similar to what the patients do, and I think it's really, really important. But I want to also mention something that I think we didn't mention, that what really makes the program unique when Tania talked about the NYBEST model is that we really provide the nurses with the language they need to be successful. Like, they have the skills, like Tania mentioned it, but a lot of times is the language that holds them back and become really successful in taking the exam. So we do provide a good service for that. And the nurses, a lot of them are, before they're taking the test, they work as home health aides, and they are also exposed to the virus because a lot of times their clients and their patients have the virus. Yep.
Well, just listening to the two of you talk, a lot of things come to me, which is, again, I think one of the most fascinating things about the virus and the pandemic and what it's happened to our country is that how it makes us pay attention to what are the important things in life. I think a lot of people are finding this out, like when you're cut off from a lot of things, you take time, you take stock, you start realizing what are the most important things in life. But again, we could say that we have just come out of, or are still in, one of the darker times in U.S. policy towards immigrants. And so here we are again when it's time for helping solve something that's really kind of important and it's challenging the country. Who is here? Who can possibly help? Again, is the immigrant population. I watched something over the weekend about the food industry is struggling as well. Half the population of the food industry is the immigrant population, and we're going to be facing problems not today, but in the coming year with that industry. And again, it's immigrants that are carrying the load, a large load. And so I guess I'm a little concerned when I hear that the president is closing the borders after Tania just finished saying to us that one of the things we need is licensed medical professionals from other countries who can come in here. I also find it interesting, one of the things about LaGuardia that I always say is, I know what my students are going to look like because I just look around the world and I see where are people in trouble, where are people coming from to the United States. Those kids are going to be in my in my classroom. And so it's fascinating that, again, like you were talking about, cultural competency, which is an aspect in education, in the healthcare professions, but also a lot of other professions, where that is so important, that we know how to work with folks who come from other places, speak other languages, have other customs, and work with them in a setting that is as important as, like, let's say, the healthcare profession, as well as education. But anyhow, so you just listening to the two of you triggers a lot for me. I will say that in putting together this show, I did speak also to Patricia Dillon, and she was telling me that, again, I guess one of my great concerns is these are students. I think of them as our students, even though they're adult and continuing ed. They are LaGuardia students who are moving into the profession right now in a very dark time. Conditions, again, the facilities are understaffed, undersupplied. They're being exposed to the virus as a result of these things. And the death toll is staggering, and which is a very traumatic. I mean, I think of it almost in terms of like a MASH setting, like a mobile army surgical hospitals, where folks are coming in, and the percentage of folks who don't get out of there are high. So I'm wondering what can we do for our students in that area in preparing them for what they're going to experience, or do some of them already come with those experiences from their other countries in the work that they've done? Because I know a lot of folks come from countries where they've experienced whether it's violence or different kinds of disease or things with food insecurity. Do you want to talk about that at all, Paula or Tania?
I mean, I can say that, I think our nurses, are very equipped to handle what's going on. I mean, as you mentioned, Hugo, we have nurses that come from Haiti who have experience in dealing after the earthquake. We have nurses who come from, Russia, former Soviet Union, a lot of, refugee experiences, and they know what it's like to function in a chaotic environment, and have that experience and the sensitivity, to really push forward. I was reading an article yesterday, and in a way, more so equipped than United States trained nurses, because they have that experience of already, living through crisis and managing with, limited resources. I mean, this issue with the masks not being available is huge, but, a lot of our nurses come from countries where that wasn't even an availability. So you make do.
Right. I don't know what happened to Tania.
I had to do this on my telephone because my laptop wasn't working, and of course, everybody wants to call and text me right now.
Was that what's happening? Sorry. Right.
Sorry. But yeah, I was saying that, they're more so equipped than the United States trained nurses because they already have that ability to function with less.
Right.
So that's something that, we really feel strongly about, because, it in a time like this when you need to have, all hands on deck, and a lot of the limitations to having that happen is a lot of the bureaucratic, red tape. I mean, you mentioned, Hugo, like the borders closing, and I mean, some of the immigrants who are healthcare professionals who have permission to work, and there's a backlog at USCIS, for example. So their work authorizations are taking longer, to happen, or the reauthorization. So that's another issue that affects. And there's also some limitations with certain visas, like you can't travel, like if there's a licensed nurse who was educated outside of the United States, who lives in another state, they may not be able to travel to California, New York, and help out with the crises here because of travel restrictions.
Well, that's a whole other issue, yeah.
Yeah, a lot of these things are really impacting. And then with New York State Education Department, as we were saying earlier, if their permission to test is also, a barrier in, getting invigorating the workforce in this way, a faster process needs to happen to help expedite that permission.
Yeah.
And then if you put into account the fact that in their countries of origin, their schools are closing, their licensing authorities are closing because of COVID, because this is a global thing going on.
Right,
So,
and they need their nurses too.
yeah, they need their nurses, and the nurses who need to get their transcripts and who need to get their licenses, validated, can't get it now because things are closed over there. So,
before Paula jumps in here, I got to say, I've forgotten that this format affords us something unique, which is the Twitch people are sending in questions. So can we get in a couple of questions? Let's see. One of them is from Elizabeth Strike, who is asking, is there a clinical requirement for international nurses in the Welcome Back Center program? And if so, is it on hold given COVID as well?
No, there isn't a clinical requirement because they are already nurses. They were nurses in their country.
Right.
They already got their degrees, and it's basically what we do is to prepare them for the NCLEX examination.
Okay, here's one from what looks like Hiva12221. If there's a need for nurses, there should be an alternative means to take the test. That's unfortunate. The exam has been paused. And I don't know if you're hearing any information in your field about this. Like people are saying, like, we got to find another, like, you put somebody in a room with a camera and you watch them if you're worried about them cheating on the test or something, right? I don't know if you've heard anything. Do you want to say anything to that statement?
There are actually some programs that you can purchase to and install in the computers. So not in the computers, but if the student has to take a test, there are some programs that you can use to protect, to make sure students are not cheating. We're going to start using that with our current nurses. Go ahead.
yeah, but in terms of the NCLEX exam itself, I think those centers are being opened little by little. They're doing some changes to allow, I guess, a faster turnover, and that they're shortening the time that it takes to take the NCLEX. And yeah, I think this thing hit us all, and even that program that Paula was mentioning, the demand now for these types of services and alternatives is so high right now, and like the technology and all these people manufacturing these solutions like can't are it's hard to keep up. Yeah. It's hard to keep up. So that software Paula was mentioning, I know it's like thundering.
No, you don't know. Like, for some reason, a light in my office just exploded. You guys can you still see me?
Yeah.
Okay. I'm a little darker now, though. I don't know what that's about. So I have been.
It's thundering over here. That's what I thought you were talking about.
I mean, the light literally just exploded in my face.
Oh.
This one looks like it's a plug, but it comes from Slamer Girl. So it says, what do you think are the most important things for the nurses and nursing students you work with to keep in mind right now with regard to your programs and the larger challenges facing us right now? In other words, any advice?
Well, I can say that I think the biggest thing to maintain is hope and connection to their goal and to their mission as nurses. Since this crisis started, we created an online support group for the nurses as a means to keep them engaged with, since there's a hold on their ability to test right now, to keep them engaged with their studying, to help manage the anxiety, the fear, all of the challenges that the social distancing and situation has created for us all. So I think it's really important for our nurses to maintain grounded and to maintain connected to their, their sense of strength, so that way they can push forward. I mean, I know nurses personally who, are burning themselves out, because of the limited capacity issue, and they do so because they love what they do. So I really, feel, nursing is a special profession, and yeah, and just to remember that calling.
All right, Paula, anything you would chime in as well?
No, Tania said really well.
Okay, well, here's another question then. Well, no, this is just kind of a shout out from Lylint. It says, or Lily NT. It says, hello and thank you, Welcome Back Center, for all you're doing for us. And then she says, will NCLEX fee will be waived for students in the Welcome Back Center as well as other students in the nursing program?
Waived?
Well, I guess she maybe they heard about the foundation helping out. So I guess they're asking, is how is somebody eligible for the foundation dollars in order to take? Is it based on need? Is it, I guess there's no GPA because it's a continuing ed experience, right?
Yes.
The foundation has that too.
So it's a foundation scholarship that it was created especially for those immigrant nurses that need help with the testing.
Right.
So yeah.
And I also want to say that one of our programs, it's funded by the New York City Department of Small Business Services, and they cover the cost of the exam as part of the grant. So we're running multiple nursing programs under the Welcome Back Center and Center for Immigrant Education and Training. So I just wanted to make that clear. Shout out to SBS.
SBS. Okay.
Yeah.
Again, SBS is
Small Business Services.
New York City Department of Small Business Services.
Thank you so much. Okay, well, guess what? It's 2:54, and I always leave a little time for some music. I think I need about 4 minutes. So this is kind of an opportunity to say any last remarks or anything, any thoughts about moving forward, or any last shout outs, anything anybody want to thank, or anything else you wanted to say, either one of you? I'd like to begin first.
I just want to say thank you for the President for Career for acknowledging the work we do, and for the continuing education department, the ACE department at LaGuardia, for supporting us through all these years.
That's right.
Yeah.
I'd like to give thanks to our partners in the Health Sciences Department, the chair of the Nursing Department, Phil Gimber, who's been with our program since 2011, and has really helped us develop the curriculum and the education. I'd like to give thanks, as Paula started off with, to the entire team at the Welcome Back Center, our educational case managers, Candace and Diana, who do a fantastic job making sure students are moving forward and have all the support they need. Our ESOL professionals, Landon Randolph, Paris Delani, everyone who participated in the program throughout the years. I think our success is really, dependent on everyone's collaboration towards this goal. And to our students, because I think our students are pretty phenomenal. They just, come here and have so much drive and ambition, and start from scratch in many ways, and are really, really focused on making, their goals and this country, as by an extension, better. So I just want to give a shout out to them.
It's always our students, isn't it? Well, I just want to say thank you to the two of you for being on the show, talking about this. I'm guessing you're very busy. I'm busier than I've ever been now, and taking the time to do this. And I want to thank the folks who've listened to us today and sent in questions for our inaugural show, and as well to my engineers today, the director of the radio station, Jamie Riccio, and also Christopher Pope, who's our new tech in the radio station, who figured out this way for us to do this, even though we can't get into the radio station to do the show. So you've been listening to and watching what's going on. I've been your host, Hugo Fernandez, and my guests today have been Paula DaSilva-Michelin from the Center for Immigrant Education and Training, and Tania Ramirez, Program Manager for NYC Welcome Back Center. Thank you, ladies, very much. And Tania, I think you might have a career in TV. If I could just get you to look at the camera the whole time. Thank you too for and tell your father not to send any text messages. So thank you to the two of you for being on the show. And I'd like to take us out the way we came in. So Professor Riccio, if you can close the show with what's going on. Thanks for listening.